Hey guys, it's Wayne here, and today I want to teach you how you can ace your physical therapy interviews. Let's get to it. So, you just graduated, you passed your MPTE, you got licensed in your state. What now? Look for a job, right? And so with this pandemic going on, right, most people don't want to have interviews in person and they're usually doing Zoom calls. So, first things first, let's get changed. Let's do something else. Yeah, this is better. So now that we're changed, next thing to do is make sure that you have really good lighting. All right. Also, a good thing too is make sure you get a haircut and you get shaved if possible. All right. Clean and cut is simple. All right, and it will give good first impressions. So to have good lighting, a few things you want to do. Okay, you can either sit next to a nice lit window, or you can grab one of these bad boys right here, like this, all right, as a ring light, and it'll give you really good lighting without blaring your face and making you look like you're angelic or anything. All right, keep your skin looking smooth, and your employer might like you for that. So what's really going to help you besides the ring light, looking nice and clean, having a good camera, is the fact that knowing what your employer is going to ask you, right? And so some of the very common questions what they'll ask you is, what did you do for your rotations? What do you like and dislike about physical therapy? Where do you see yourself in 5 years? Do you have any ambitions outside of physical therapy? School? What were you like in school? All right. What they really look for isn't a person that's such a good therapist, because they know you're a new grad, right? What they want is a person that can build good rapport, good bedside manners, and just works well with the team. Okay, you want a good team player, because they don't want anyone that's really hard, that I wouldn't say moldable, right? But they still want a person that's very good at being independent and can learn quickly, because a lot of clinics nowadays are a little busy unless you're in the cash based or if you're in a hospital. But even then, right, you want to make sure that you can actually hold your own, you learn quick, learn fast, right, and know how to be better. Okay, being a better physical therapist isn't just getting more certifications and going on Instagram and learning all these intricate exercises. What it is how you can implement what you learned in simplifying it down for your patient so they can actually do them, make them more compliant, and then your plan of care is going to be great, and then next thing you know, you'd be a great physical therapist. Now the employer understands you a little bit more, you get to ask questions, okay? Because you want to understand where you're stepping into and what you're getting yourself into, okay? So some questions to ask your employer is, what are the productivity standards? What are the demographics that you treat? Okay, what kind of injuries do they treat? All right, do you get one-on-one evals? How many patients do you see per hour or half hour? Okay. And then, is there room for growth in the company? Do they have any community outreach things, right? You want to make sure that all these things are solidified and you kind of understand a little bit about what's going on in the clinic and if the clinic fits you. Now, let's say you got through some questions and you're really interested in the job, but you kind of don't understand the lay of the land. A good question to ask is if you can shadow a PT for like the morning or the afternoon and just kind of see how things are. Right? You're not really asking for a CI, but just kind of seeing how it is. Most employers will say yes to that, because then they understand, okay, this person's kind of serious. They kind of want to understand what's going on. And when you're doing that, don't be afraid to ask questions to the other employees around the area, right? The aides, the PTs, the PTAs, right? You want to make sure that you get a better understanding of the culture of the clinic, so that you know you're a right fit, and so that employer knows you're a right fit, right? No one wants to work at a place where you get a lot of arguments and you hate your coworkers and you just hate each other and then you're just working on your... It doesn't work like that, okay? You're going to be spending time with these people day in and day out with a common goal, and you want to make sure that you can keep that common goal going forward, right? You guys are a team, not just a single employee, but you guys are a team, and you guys are healing people to get them back to where they want to be. Now, hot tip. When you step through that front door, you say hi to that front desk lady or man or whoever, okay? And you kiss their ass, all right? You be super, super nice to them, because they are the face of this clinic. I don't care what they say or what the employer says, right? That front desk lady is gonna be your best friend, okay? If you're gonna come in, you're going to kiss her ass, right? and then make sure that she likes you, because if she likes you, okay, then the boss is gonna like you. All right, because the thing is, when you walk into the clinic, that's the first person you see, right? If you're nice to them and they're nice to you, then they'll give a good word to your employer, and then there you go, right? Cha-ching. So now that your employer likes you and you visit the clinic and then you kind of understand the culture of the clinic, we come down to the elephant in the room, which is salary, okay? So when we're discussing salary, okay, I want you to know that you should not be underpaid. Okay, so I'll link down in the description below a link to Ben Fung. And so what he does is he lays out all the average hourly rates in the country and by state. And then they'll kind of show you like the standard deviation and things like that. So check that in the description below. So when it comes down to pay, you kind of want to understand what comes along with it. Okay, so a few questions to ask even before the salary is what can they provide in terms of with your pay, okay, as an employee. Okay, do you get benefits, medical, vision, dental, things like that? Okay, do you get paternity and maternity leave? Do you get a 401k? Do you get a stipend for CEUs or certifications? And then vacation hours. Okay, those are just some things to kind of ask and see what your hourly pay or your salary is compared to all of that. Because if you're getting the whole gambit, okay, and then you're getting paid like $36 an hour at an outpatient clinic, it kind of, okay, that's still on the low side. But the thing is, your employer is paying a lot of money to kind of keep you there instead of, you know, giving you a higher pay. So think about this, right? If you're getting paid like $36, $38 an hour, okay, but they weren't offering you health care, they weren't offering you a 401k, they weren't offering you CEUs and things like that, that's a lot of money out of your pocket, all right? Like, when it comes to health insurance in general, it's super expensive, okay? And most places will either offer you a PPO or HMO, but the thing is, it's still like a few $100s a month. So if you calculate it all into there, your employer isn't just paying you the hourly wage, okay? They're also paying you for other things and benefits. So those benefits have to add up, and plus your hourly wage to kind of see, okay, is this worth it? So those are just some of my tips for interviewing through the pandemic. All right, if you guys have any questions or any comments, please drop them down below, smash the like button, and please subscribe. All right, peace out, guys.